And we interrupt your programming for the update out of Madison County this afternoon.
Let's listen in.
Our community response to COVID-19. Our speakers today will be David Spillers from Huntsville Hospital and Mayor Tommy Battle from the City of Huntsville. You will note that we are sitting at least 6 feet apart according to CDC guidelines, as well as our own best practices to separate and sanitize. At this point, I'll give you the current numbers. There are 15,718 confirmed cases in the state of Alabama, 310 confirmed cases in Madison County, resulting in 4 confirmed deaths in Madison County. We continue to monitor this and respond accordingly. So at this point, we will go to Mr. David Spillers from Huntsville Hospital.
Thanks, sir. Good morning, everyone. Madison County continues to be an anomaly in the state. We have 9 inpatients in our hospital today. Talked to my colleagues that are in Tuscaloosa, Montgomery, and Mobile, where they have numerous inpatients and communities full of positive patients. I strongly encourage our community to continue doing whatever it is you're doing to help us keep those numbers low. Certainly makes our lives easier. We've continued to test a lot of people. System-wide, over 16,000 tests have been performed by our system. There's probably an equal number of tests now that have been performed in North Alabama by other testing organizations. Our percentage of positives continue to remain low out of that number. We've got about 3.14% of the Madison County people that we've tested have come back positive, about 2.87% in the region. Both of those numbers are lower than you will see on the state dashboard. I can't tell you why there's a difference between our numbers and the state. I only know that our numbers we're very comfortable with. When you do all the testing and you keep all those on the same computer system and track it the way we do, we're very comfortable with the numbers that I'm presenting to you relative to the tests that we performed. Coming off the holiday weekend, we did a lot of tests yesterday. Well over 300 tests here in Madison County. We could probably talk more about that later. It's probably a combination of being a little over 2 weeks out from the time we open the economy up. Also, probably some pent-up demand over the weekend. Statewide, the numbers of positive cases remains high. Yesterday was a significant number for the state. I think there were over 650 positive cases statewide. Probably one of the, if not the largest, one of the larger days we've had since we started this. And again, I hope we'll continue to be the anomaly in the state, and our numbers will stay low. Around us, where we have some of our system hospitals, Franklin County and the Shoals area continues to see a large increase in numbers. The Shoals area, and in the Shoals area, Colbert, Lauderdale, and I'll add Franklin to that because that's one of the areas that has a large number of positives. They have about 786 cases in those 3 counties, and our hospital in Sheffield, Helen Keller, actually has more inpatients than we have here in Huntsville. They have 10 confirmed inpatients in the hospital there, and they've been running 10 to 12 for about the past week to 10 days, managed in that area. Marshall County, 660 plus cases in Marshall County, but we don't have a single inpatient in our facilities in Marshall County. So even though they've got a large number of positive cases, they're not converting to inpatients. I can't explain that to you. I don't know why that is. We did have at one point 6 or 8 inpatients in the hospitals down there, but right now they have 0 patients in the hospitals that are COVID positive. We've always believed testing is important. We continue to believe testing is important. We have now done over 20 remote test sites, test clinics, where we've taken our mobile medical unit and teams out into the community to test. That continues to be popular. We're going to continue to do that, try to do 1 or 2 a week in various locations to take testing out to the community. The other thing we talked about in here is asymptomatic testing. We've now done close to 1,000 tested close to 1,000 asymptomatic patients, and we've had 1 test positive. So clearly not the best use of testing. anytime you've got a limited resource, you want to make sure you're focusing it on the area of need. And for somebody who just wants to be tested for the sake of being tested, that's probably not a good use of that resource. And usually when people see what it requires to get a test, many people will say, well, maybe I'll wait till later. It is not a pleasant test to have performed on you. So we are finding a better use of testing for asymptomatic patients, particularly as the economy's opened up, is when a restaurant has someone test positive and they need to test the employees who've been working with that person. Other businesses have called us and said, hey, we've had an employee test positive. Can we get our employees in and get them tested? We think that's a smart thing to do. Isolate the person who's positive, find out if anybody else is positive, get them isolated as best we can, and continue to watch those people who've worked closely with the people who have tested positive. We're going to continue to do that and provide that support to the community for businesses when they ask. We had at least two or three businesses yesterday call us yesterday and say, we've got somebody who's positive, can you test our employees? So we're doing that. We've talked a lot about antibody testing in here. I continue to think antibody testing is unless you're going to give everybody an antibody test to get statistical information, I'm not sure what you do with the information, but there's a demand out there for antibody testing. We have a very reliable antibody test that we run on our Abbott machine at the hospital, and we've decided to make that available to physician offices that use our lab. So if you see a physician and a physician wants to order antibody testing, we can do that and get the results back fairly quickly. Since it's all run in-house, generally it's the same day result back to the physician office. The physician would need to consult with the patient on that test just like they would any other test that a physician runs on a patient. Let the physician and the patient discuss what that means and how they go about their life if it's positive or negative. I expect most of those will come back that people don't have antibodies. Just statistically speaking, that's just where the numbers are going to be. But if you want that testing and you see a physician and the physician orders it, it's available in our lab if you're curious. Everything else at the hospital is busy. We opened back up. We started doing electives. Our elective schedules are almost full. We are not quite as efficient as we were prior to COVID because our processes, the things that we do, slow us down just a little bit, primarily the waiting and patients being brought in and not in waiting rooms but coming in from cars when it's time for their procedures. So that whole process slows us down a little bit. To accommodate that, we're doing more of our procedures on Saturday, far busier schedules on Saturday than we did pre-COVID. Try to get people in and get those elective procedures performed. Census is back up to a seasonal, about where we should be this time of the year. But I do strongly continue to encourage people that if you have a health care issue, don't avoid a hospital or emergency department because you're afraid of COVID. You're probably going to be more likely to catch it somewhere in the community than you will be a hospital. Because many of the COVID patients or the patients who think they're COVID positive are going to the flu and fever clinic. We don't have many showing up in our emergency department. So you don't have to worry about being in a waiting room and catching COVID. And we're also trying to limit the people in the waiting room in the emergency department, just like we do everywhere else. I think the future of a lot of things is you wait in your car until you're called, until this crisis is over and we have a vaccine, which is somewhere too far out for me to predict. With that, that's all I have until we have some questions. Thank you.
Thank you, Mr. Spillers. Now we'll go to Mayor Tommy Battle, City of Huntsville.
Today is May 27th. 3 months ago, on February 27th, we had our first press conference to talk about COVID-19, talk about, back then I think we were calling it coronavirus even. And as we went through that, we started 3 months ago working in partnership with Huntsville Hospital. David Spillers has been on our daily call for the past 3 months. Pam Hudson from Crestwood has been on our daily call for the past 3 months. Either Judy Smith or Dr. Landers have been on our calls for the past 3 months with EMA, who has been on that call each and every day, and each of the 3 local governments have been in there, plus Redstone Arsenal, and it really has been a team effort. A lot of people ask why Madison County has done better than the rest of the state or the rest of the Big Ten communities, and as we've watched it, we've been able to do it because of community effort and the effort that has been put forward. We've really seen the value of a public hospital here. Having a public hospital means that you can spend money on things that private hospitals that are there for profit cannot. We can spend it on flu and fever clinics. We can spend it on taking buses out to underserved areas to make sure that each of them are able to be tested. And as we do that, we've been able to come up with a plan and a strategy that has made our community a success. 310 cases yesterday. We were up 8 from the day before. We're seeing just a little bit of a rise. We knew that we were going to have some surge out of this as people came back together and got back together. This is the 14-day anniversary of the first opening of retail centers. Today, this past Monday, we opened up restaurants, and I think it's a very slow ramp up as we are opening up restaurants, and people are being very careful about getting out. This weekend, as I was out, I want to say congratulations to the people of Huntsville, Madison County, because there were a lot of people out there with masks, wearing those masks, staying separated, using good hygiene, washing your hands, doing what we have done for the past 3 months is what's made us a success. And we've got to continue to do that. If we continue to do that, we will find that our community will be one of the most successful communities moving through this pandemic and coming out of this pandemic. Still, is there an end in sight? I think Mr. Spillers just kind of told you that the end is not totally in sight, but we are going to have an economy, and we're going to walk that fine line of opening the economy and also making sure that our public is safe. And what we're seeing so far is that it's working. The plan is working, and we're going to continue to work that plan. To each of the people out there who are out there taking this seriously, wearing masks, staying separated, doing all the things that we've asked you to do, thank you for your cooperation. Thank you for working with us. There will always still be some hot spots. We still get calls on those and have calls pretty regularly on those. But those hot spots are places that we just need to pay attention to. And we'll pay attention to them. We'll work on them. We'll try to make sure that everybody follows the same rules. To our team partners, this has shown what makes Huntsville, Madison County, City of Madison special. We work together in partnerships, and working in that partnership, we've made a success for our area. Thank you.
Thank you, Mayor Battle, and thank you for watching today. We will be back here again on Friday, May 29th at noon for another daily briefing. Until then, critical updates will be posted to the City of Huntsville's COVID-19 webpage, as well as the websites of our other partners here today. Until then, stay safe, stay separate, and remember to sanitize. At this point, we'll take questions. As you come to the mic, please identify yourself and who you're affiliated with, and we'll allow one question and a follow-up.
Kate Smith, 48 News. I just wanted to clarify with Mr. Spillers, Huntsville Hospital is not going to allow anyone to come now to get tested for coronavirus?
No, we are continuing to test asymptomatic patients. We've done those at our flu and fever clinic. We prefer that those tests be reserved for people who have some reason to be tested. So you're asymptomatic, but your friend's got COVID, so you want to get tested, as opposed to, I think I'll get tested for COVID, because there are people who just want to get tested, right? We prefer that people use some logic behind why they choose to get tested, and we're making those available there. We are going to test a lot of asymptomatic people here in the next few weeks. I expect from businesses that find somebody positive, and we help test those other employees to make sure it's not rampant in those organizations.
Okay, great. And then my follow-up question is, last week there was a lot of talk about Montgomery and Birmingham filling up ICU beds. Is there a chance if Montgomery is sending people to Birmingham, then Birmingham could send people to Madison County?
Well, this goes on in our state on a regular basis in the middle of the winter and flu season. Huntsville and UAB tend to take patients from all over the state, UAB more so than Huntsville, but when UAB fills up, we start getting patients from other parts of the state. That's a role we serve. I could see a point where more patients are shipped from Montgomery. What usually happens is more patients from Montgomery get shipped to Birmingham, and then Birmingham North patients get shipped here because Birmingham's full. So that's generally the way it works, although we've had referral requests historically from as far away as Baldwin County for trauma patients and other very, very sick patients. So we deal with this all the time. It sounds like a crisis. In the winter, our ICU beds are generally full. When we have a bad flu season, it's fairly unusual for them all to be full this time of year. But I think unless the numbers just start doubling and tripling from where we are today, I think as a state we will be okay. We'll distribute the patients as needed. As I mentioned, some of the patients at Huntsville are not from Madison County. They've been transferred in from other smaller facilities that it felt like they needed that patient to move to our facility. That's just the way our healthcare system works.
Great, thanks.
Brian Lawson, WHT. For Mr. Spillers, you talked a little bit about workplaces opening up and having an employee test positive and kind of a program to follow in that, or getting some requests along those lines. Can you talk about what that would look like, how you're handling that? Or are you going to sites? Are they coming to you? And how do you see that expanding?
So the way that's worked to this point is, if an employee tests positive, the companies call us, and we generally set them up to come to the flu and fever clinic. They generally give us a list of all the employees that have been in close contact with the person who tested positive, and we check off the list, and if somebody doesn't show up, we call the employer and say this person didn't show up for the test. We run the test, and then we if any are positive, we'll go through the process with Alabama Department of Health and quarantine those patients and track the ones who came back negative. If they get any symptoms, we would bring them back in for testing.
Thank you. For Mayor Battle and Mr. Spillers, as you've had the coordinated calls that you're on, talking to your peers around the state, I wonder, we're seeing case numbers that are substantial relative to where they were, say, a month ago. Wonder what you're hearing and what you're able to piece together about the profile of those cases, if any pattern is emerging, if you've got a picture or any visibility into that we might better understand what we're seeing out there.
Go ahead. They got the cameras already on you.
Yeah, okay. You're talking about the patients that actually get admitted to the hospital?
No, just we're seeing meaningful spikes in test numbers or positive cases relative to where we were. I'm wondering, is that for church services? Is that a wave of nursing homes? Is that just we've got more tests in more areas? And so I just wonder what you can tell about or what people are talking about relative to those figures.
So on the calls that I listen into in other parts of the state, we're not seeing any big pockets of positives here in Madison County. You know, we saw some positives that were in industries in Marshall County that created a spike. We saw the same thing in Franklin County. We may have a little bit of that going on in Morgan County now. They've seen some pretty significant increases that could be employer work-based. In other parts of the state, they're seeing some nursing homes and long-term care facilities. And it just seems that when an employee or someone who's in a long-term care facility or nursing home becomes positive, it tends to reproduce itself very quickly and create a problem. We have been able to avoid that. So we try to track back every patient that's positive, and that's what the Alabama Department of Public Health does to see if there's a center of activity that we need to focus on. And we haven't seen a lot of that in Madison County. That's why testing for these organizations where a restaurant has an employee, they're generally shutting down, doing all the sanitation, and checking all their employees really well to make sure it doesn't create a problem like we've had in some of the other counties. As far as a pattern on translation of who ends up in the hospital, and again, that's the big worry about this is will it overburden the hospital, and will a lot of people end up becoming inpatients? You know, the only pattern that I see there, and I get the data every day on the patients that are admitted to the hospital or still in the hospital is most of these patients have many other conditions. It's still very rare to get a healthy individual that comes in and is really sick. It happens. Age groups vary widely because we have people in our community who are 45 and 50 years old that have a lot of other health problems, and it just tends to be harder on the body if you already have some pre-existing conditions, and those are the ones who generally end up in the hospital.
All right.
Yeah. And I think we've got to look at the same thing. 800 additional cases in the state of Alabama, 700 the day before, 800 the day before that. Those are significant increases, but I think what we're seeing is that the hospital system is not being overrun. Mr. Birdwell was on a call with some of his counterparts down in Montgomery and throughout the state. They felt like that they were very achievable to be able to take care of those patients as they came through. All the tools got to be used. You got to have your contact tracing. You've got to make sure that as you have more tests, you're going to have more positives come out. As you go through the whole scenario of the disease, you're going to find a lot of things are going to pop up more positives. And I think right now we're doing a lot more testing than we've ever done. This last week we did a lot of testing here. We did, as Mr. Spillers mentioned, a significant number of testing yesterday. And those will show you the numbers of real positives that are sitting out there. We're still, still very fortunate. We're still running 3% of everybody being tested are those that are coming out positive. So we're going to have to continue to do what we've been doing, and we're there to help the state if the state does need the help.
Thank you.
Megan Reyna with Way 31 News. This is for you, Mr. Spillers. You mentioned antibody testing being available through the hospital. The CDC's recommendation is mentioning that 50% of these tests could actually come out negative or false negative. Is there a concern behind the type of testing you're using?
No, we use a test by Abbott, and the specificity on that test is about, I got the number here, 99.81. The sensitivity on the test, 0 to 6 days after a PCR test, is 65%. Between 7 and 13 days after a confirmed positive, it's 88%, and after 14 days, it's 100%. It's a very reliable test. What you do with that test, if it comes back positive, you need to discuss with your doctor. It doesn't mean you're Superman or Superwoman and you're immune and you can go do all these things. You could be COVID positive when you have the antibody test. There's a variety of factors that need to be discussed with your physician when they order this test. There are many people offering antibody testing that have very low sensitivity and specificity, and that just doesn't do much good, even though I'm telling you this one might not do much good, but a lot of people want them.
Do you see an increase in people now wanting the test? Are you expecting more now that, we're coming out of the holiday weekend, now that it's more available?
Antibody or PCR testing?
Antibody.
Antibody testing. We just had over this entire 3-month period, we've had a lot of people who've said, I was sick in January and February and I think I had it. I want to check and see if I got antibodies. Or I knew somebody who had it and I want to check and see if I got antibodies. I think there's been a curiosity about that for a long period of time until we had a test that was reliable and until we had a methodology where there was a process to get that test, where there was a discussion with the physician. We weren't going to make it available. So we did make it available because of consumer demand. Now, how many people will actually go have blood drawn to get a test out of curiosity? I don't know. I don't know how many people will take advantage of that. They're going to have to make an appointment with a doctor, get in, see a doctor, and get it ordered. It's not as easy as walking down to the drugstore and getting it. At some point in the future, you'll probably be able to do that. But today, it's a process. So if you want one, you're going to have to work to get one.
Thank you.
Paul Gaddis from AL.com. Mr. Spillers, I just wanted to follow up a little bit about Marshall County and no inpatients, and what do you attribute to tamping down what was one of the early hot spots in the state to where, I guess, I don't know if this is the right words to use, but it seems to be a little under control, so to speak, at this moment?
Well, you know, anything I tell you would be just kind of speculation or maybe a little educated guess. But when the numbers started going up, the Alabama Department of Health and the county and other organizations where they had outbreaks tried very quickly to address it and get everybody tested and change their processes and procedures and so forth and so on. So I think there was a lot of work done in that community to try to mitigate the problem, and I think the numbers have leveled off. I don't think they're growing nearly as fast. The question as to why many of those didn't translate into inpatients, I can't answer. I don't know. I wish I did know. Somebody's going to study that at some point in time and say, for this reason, whether it be a different strain or whatever, these people didn't get as sick and didn't translate to inpatients. It seems like every 30 or 40 days we learn something new about this, about COVID-19, and I'm sure, you know, hindsight's always 20/20. 6 months from now, we're going to know a lot more than we do today, and that might be something for people to study as to why you have that many cases and not that many admissions out of those cases.
And just to follow up on that, and I think you probably already answered the question, but I was wondering if maybe a playbook or a strategy had emerged that could be applied elsewhere in hotspots.
Oh, I think that around the state, people are learning every day when they have a hot spot the things to do, and Alabama Department of Health sees it all because they're all over the state, and I think they help, if called in, they will help people put processes and procedures in place. I think we're learning more every day about how to keep from transmitting this, how to work and keep people around you from getting it. But there's no perfect system. There's no way to absolutely keep people from getting this unless you isolate them at home and never let them go outside. And I think we've kind of determined people aren't going to do that. You know, we have a pandemic fatigue in our community. People aren't willing to do what they were doing 30 days ago. So, yeah, I think we learned a lot more. You know, I was shocked at the news that came out of the CDC last week that maybe this isn't as contagious on surfaces as they might have originally thought. That said, I still see people cleaning a lot. That's good. I think why not be safe as opposed to just say, well, we're not going to do that anymore. And you know, that's I've been a promoter of masks, even though the evidence is iffy. But you know, just a logical person says if you and I are talking and both of us have on a mask, you're less likely to spit on me. If you're less likely to spit on me and you've got it, I'm less likely to get it. So why not take that precaution, right? We'll learn more and more as time goes on.
Very good, thank you.
Paul, let me say this. You know, I think that the Alabama Department of Public Health gets a lot of credit. There's a lady there, Judy Smith, who's on our calls every day. Very excitable lady. She has a hot spot. She jumps on it with both feet and wrestles it to the ground. Works with Mr. Spillers in the Huntsville Hospital system because they're in just about all 12 counties that she's been working with, and they have a lot of you can tell they have a lot of off conference calls with each other talking about what is happening in different areas, and the attention that they're playing to it in the early days when it first kicks up, when it first comes out. That's kind of the key to it, because if you get ahead of it, whatever you do today is going to affect you 14 days from now, and you've got to get ahead of it. And so we've been through 3 months of it, so 6 cycles of 14 days, and every time that she has seen a hot spot, she and the Alabama Department of Public Health, along with Huntsville Hospital, have been jumping on it with both feet and doing it early. And by doing it early, I think it makes a big difference for us and makes those hot spots kind of flatten the curve on them as we go through.
At this point, we'll conclude the press conference. Thank you for coming.
All right, you have been watching the